I just recorded a PSA on Breast Cancer Awareness Month for the month of October. And it occurred to me that I have not shared my breast cancer diagnosis story. And it is because it requires me to be vulnerable. But I think it can also be a great learning opportunity as to what not to do, because I have learned so much since December of 2022. So I am 42. We, as in my husband and I, had dropped our medical premium. It was expensive and we hadn't gone to the doctor in a long, long time. Life was grand. We were healthy. Everything was gravy, right? So, probably, I hate to say it, about a year and a half before my diagnosis, I had a small lump. And I was aware of it. I wasn't the best at doing breast exams, but I would do them occasionally, and I did find it one day, but it was very small. And honestly, I chalked it up to like a fat cell. So I just kind of kept an eye on it, and I noticed it would swell, so to speak, with my cycle, my menstrual cycle. That time of the month where your breasts get tender and they feel achy and swollen and just they suck. I noticed it felt like it was a little bit bigger. And then once all that soreness went away, it would shrink back to normal size. So I just figured it was a fatty cell. After a while, I noticed it was getting bigger. Then we finally got medical insurance, and my husband and I went in right away and had a full physical. She did a pap smear and a physical breast exam. I completely forgot to mention it to her, nor did she notice it. Probably 6 months later, I noticed it was getting bigger, so I made an appointment and I went in, and she confirmed that it was there, and she figured, due to my age, being 41 at the time, that it was probably just a fatty tumor and it was non-cancerous, so let's just keep an eye on it. If anything changes, let me know. So I ended up going back a couple months later to be like, hey doc, it's getting bigger. Yeah, so October 19th of 2022, I had my doctor confirm it, and I didn't tell my husband about it. I was trying to keep it from him just in case it was nothing. I didn't want to worry him. He happened to figure it out because he was like, doctor's appointment, huh? He was like, is everything okay? You already recently had your diabetes check-in. Why did you go back to the doctor? So I had to let the cat out of the bag and tell him. I didn't tell anybody else. So then that was October 19th. December 7th, I finally had my mammogram appointment. I went in. I love that they give you results right away so that you're not at home freaking out, full of anxiety. They give you answers before you leave, at least at my clinic. They did a diagnostic mammogram, and they were like, yep, something's there, which didn't surprise me because I can tell you I had a lump. And they were like, we don't like the look of it. Do you have time to stay for an ultrasound? And I was like, sure, let's do what we got to do. So then we ended up doing an ultrasound, and they were like, we really don't like the look of this. We would like to do a biopsy. And that is when shit got real. They had left the room to check the scheduling, and they came back and they said, it's December 7th. We wouldn't be able to get you in for a biopsy until like basically the end of the year or like the end of the month. And they were like, would you mind staying and just doing it now? And in a way, I'm kind of glad it happened that way, because it didn't give me a chance to like freak out about it and be like, looking at the calendar, I've got 2 weeks until biopsy date. Like, shit got real right away. We're doing it now. So God bless these people. They skipped their lunch break so that we could just do my biopsy right then on the spot. And they numbed me up really good, and they were so caring and kind and professional. And we did it right there. And a week later, December 13th, my primary care doctor's a nurse called in the evening, and I had her on speakerphone, and my husband was back there in his chair, and she called and said, "I am really sorry, you have breast cancer." And that is when the bomb went off and everything went radio silent. That's the day my world got turned upside down. I then, the following day, had a appointment with my primary care provider who explained that it was breast cancer, it's triple negative, blah, blah, blah. Honestly, I don't remember a lot from that appointment because it's kind of like I'm smiling and nodding, but it's just kind of it's a lot of information, and I'm grateful that my parents were there to support me and be a second set of ears, because I was going to be an independent woman and just go by myself, but of course my parents wanted to be there. My husband wanted to be there too, but he was at work. Yeah, I won't go into the rest of the timeline with genetic testing and everything else. I can do a video on that if anybody's curious, but the moral of the story is, if you see something or you feel something, please say something. I am so very fortunate that all that time had passed, like a year and a half, maybe even 2 years, and I am blessed to just be diagnosed with stage 2. It could have been so much worse. It could have spread. So please do your exams. If you see something or you feel something, say something. Don't let your finances or lack of insurance or schedule or fear stop you from getting your exam done. And if your doctor says you're too young, then get a second opinion or push your doctor back, because I have seen women as young as 20 get diagnosed with breast cancer. It doesn't discriminate. Cancer doesn't care how old or young you are. It's not just for the elderly. Please, please, please be aware and speak up if you notice anything. Don't be like me. I've learned a lot going through this. Okay. I love you guys. I really, really do. And I wish you all the best, and get your boobies checked out. Okay? All right. I love you. I'll talk to you later. Bye.